Hi everyone, welcome to Gynecology Girl Talk. Today, let's talk about heavy periods. In this episode, I'm going to discuss a short recap of the normal menstrual cycle. I've done another video on this, and it might be worth nipping back to that to view it before you see the rest of this video, or you can watch it in your own time. Then I will go on to how do we know if bleeding is excessive in teenagers. I will then go on to missing school and school attendance and how we manage that. And then I'll discuss the reasons for heavy periods. And lastly, stay till the end because I will talk a little bit about endometriosis, which is really, really topical these days. So, recap of the menstrual cycle. So, the menstrual cycle consists of estrogen production in the first half, then ovulation or releasing an egg, and then production of progesterone. If the egg doesn't fertilize, the lining of the womb comes away as a period. How do we know if periods are heavy? So this is an interesting question because everybody thinks, well, maybe if you change your pad really often, maybe if you change your pad several times a day, then the periods must be heavy. Now, technically, the average blood loss of a menstrual cycle is 40 milliliters, but nobody's going to measure that. Heavy periods is if you bleed more than 80 milliliters. And there are certain things we can look for to determine if periods are technically heavy, because sometimes it can be difficult for adolescents to know, particularly if this their first few periods, they've got nothing to compare it to. So we use surrogate markers such as one, passage of clots. Now, this is a really, really interesting topic. And it is the single most important question I ask to try to determine if periods are heavy in adolescents. The womb is quite clever, and within the womb, there are substances that keep period or menstrual blood liquid. So if you bleed more than that amount, you use up all these substances, and then the blood clots inside the womb. So if with the period, the passage of clots, it means by definition you've used up all those substances that keep the blood liquid. That means you've bled more than 80 mils, and that means that your periods are heavier than normal and abnormally heavy. The other things we ask about are indeed pad changes. So if we're having to change pads every hour or every 2 hours, then that's heavy. But then having said that, people change pads. Some people change pads when the bleeding is really light because they just like the sensation of a fresh pad. The other things we think about is staining through clothes, in particular staining through bedclothes. And mum and dads, you will know because you do the washing, whether when your child is on a period, if they're staining through bedclothes, then that suggests that the periods are heavy. Because often at night you get a pooling effect and then the blood comes out. I've had people come to me and tell me that their daughters have to sleep on towels because the bleeding is so heavy. Now that's unacceptable. So that child should be seen. Take that child along. There are things we can do to help the situation. Missing school is another interesting point because sometimes girls miss school even if they're not passing clots, even if they're not staining or flooding or blood running down the legs. Sometimes they miss school when they're on the periods because the bleeding is heavy for them. And we do have a lower threshold for treatment because if girls are missing school before periods, and I've said before, periods should not affect your education. And I'm really passionate about this. If you're having to miss a school 1 day, 2 days, 3 days, every month or every other month, then something needs to be done about this. There are effective ways of managing periods, and we're skilled at it. So please go along to your GP. Now, the reasons for heavy periods. So in my first video, I talked about ovulation and that the estrogen in the first part of the cycle causes gradual thickening of the lining of the womb. What a period is the lining of the womb coming away, associated with blood from blood vessels as well. So that means the thicker the lining of the womb is, the more lining there is to come away, the heavier the period is, the more likely, again, as I mentioned before, that you pass clots. So that is the most common cause for heavy periods in adolescence. because ovulation or releasing an egg, and I mentioned before, releasing an egg does two things. It is the clock of the menstrual cycle. So if you release an egg regularly, you have regular periods. If you don't release an egg regularly, you have irregular periods. And most girls within the first 2, 3 years after periods start do not release eggs regularly. The second thing the progesterone does and ovulation does, apart from being the clock of the cycle, is it puts the brakes on the estrogen that is thickening the lining of the womb. So the first part of the cycle, the lining or the endometrium is called proliferative, and that means growing, and it grows. Then you got ovulation, and then the second part of the cycle that progesterone has the effect on, the lining is called in the secretory phase. And that means that the lining becomes more nourishing in preparation for implantation of an egg. So lack of ovulation means loads of estrogen, no breaks on the system, irregular periods, and then when eventually the period comes, it's heavy because the lining is so thick. So that is the most common cause for heavy periods in adolescence. And we know that because the periods are irregular. So we know that gives us a clue if inconsistent ovulation is the cause of the heavy period. There's a condition called polycystic ovary syndrome, and that can cause irregular ovulation as well. And I will discuss this in another podcast of its own accord, but that is usually associated with other symptoms such as weight gain, acne, which again is common in teenagers, and unwanted hair growth. But we'll get to that in another podcast. The thing to think about that can cause heavy periods as well that we don't want to miss is if your child, if your daughter has an undiagnosed bleeding disorder. So that means that when she has a period, the period would normally be normal flow, but because she can't clot, and the clotting is what stops the bleeding, clotting stops all bleeding, because if she's not clotting properly, then she will bleed excessively. So the hints, the clues to look for as if she may have a bleeding disorder are a couple. The first thing is that most bleeding disorders, you are born with them. So she will have had this. If she has it, she will have had this from birth. But often, periods are the first what we call challenge to the clotting system in a girl. So unless she's had surgery or some other reason to bleed, then periods is the first proper challenge you have to that system. So if the system isn't working properly, then she bleeds excessively, and that might be the first sign that she has a bleeding disorder. So I always ask my patient, the most common, if it is due to an ovulation, the first cause I mentioned, the most common scenario is that the periods start, they're okay for the first cycle, the first 3, 6, 9 months, they're okay, but then gradually they get progressively worse, they get progressively heavier, often more painful as well, and that's in keeping with that ovulation, inconsistent ovulation, or not releasing an egg regularly. If there's a bleeding disorder, what we expect is that from the very first period, the bleeding is heavy because he was born with it, it's always been there, and this is the first challenge. So I always ask with heavy periods, what was the first period like? What was the second and third? If the bleeding was heavy from the first period or menarche, then we need to consider whether clotting studies needs to be done, because whatever we do, if she has a bleeding disorder and we're not aware of it and it's not diagnosed, then our treatment will be less effective. Also, if she has a bleeding disorder, this is an important thing to know for her entire lifetime. If she needs to undergo surgery in the future, pregnancy, these things are all important, so we don't want to miss it, and that might be our first clue. The other questions we ask to try to determine if there's a bleeding disorder, the other questions I ask routinely are, does she have a history of nosebleeds or epistaxis? Because bleeding disorders quite frequently come with a history of nosebleeds and big nosebleeds. Does she have a history of easy bruising? And I mean very easy bruising. So a girl who, for example, plays hockey and falls and whatever, and she's okay, and you will have a bit of bruising, but I mean large bruises, that's another sign. Um, if another really, really critical one is if she has had any dental extractions. So I don't mean teeth coming out, tooth fairy business. That's not what I mean. I mean she's had to go to the dentist and have a tooth removed or several teeth removed. And sometimes it's necessary, for example, before braces or whatever. If there's a dental extraction and that is not associated with excessive bleeding, then it's less likely that there's a bleeding disorder. Because when you remove a tooth, there's nothing to compress the vessels, there's nothing to tampen on it. We call it compress the vessels. It's difficult to put pressure. So that's a really common scenario in which there's excessive bleeding, and the dentist, they have to do lots of things to stop the bleeding and compress it, and maybe she needs admission, etc., etc. Those are all signs of maybe there's a bleeding disorder. Obviously, again, if she's had surgery, for example, tonsillectomy, that's a really bloody operation if you've got a bleeding disorder because the tonsils have a really rich blood supply. That's another cause to consider. If she's had her appendix out, any operation, if that was associated with a bit more bleeding than the surgeon expected, think about it. Maybe there's a bleeding disorder here. Finally, obviously, if there's a family history of a bleeding disorder and the child starts with heavy periods from menarche, then that may be the case. I hasten to add here, though, that heavy periods are really common. And many girls I see, their mums have had heavy periods in adolescence. And as I've just said, that's really common and normal, to an extent normal in adolescence. So that doesn't necessarily mean there's a bleeding disorder if it's not been diagnosed in the mum. If she's had excessive bleeding, for example, after delivery, after pregnancy, cesarean section, whatever the case may be, then again, it may be worth having a think about that. If we think there's a bleeding disorder present, then the appropriate thing to do would be for her to be referred to a pediatric hematologist who is a blood specialist, and they do a myriad of blood tests to look for all the different components of blood, all the different clotting factors. It's a science in itself. So that, in my opinion, is not the realm to be investigated by a gynecologist, but I would refer that to a pediatric hematologist so that she can have a full gamut of investigations and reliable results to either exclude or diagnose a bleeding disorder. Okay, so the last thing I said I'd mention is endometriosis. And I see lots of girls who come to me and because it's topical, it's all over the place, endometriosis, it's all over the internet, it's all over TikTok, whatever. A lot of girls come to say, I have heavy periods, I think I have endometriosis. So I will do a video about adolescent endometriosis, but in short, in relation to the topic we're talking about today, I will say that endometriosis in itself isn't really cause of heavy periods. It's a cause of painful periods. Adenomyosis is where the lining of the womb gets between the muscle fibers of the womb, and that can increase the volume of the womb and therefore the amount of lining and increase the surface area, and that can cause heavier periods. But that is really unlikely to be present in an adolescent. In fact, I don't think I've ever seen adenomyosis in an adolescent. Things happen, it may happen, but common things being common, it would not be high up on my list of diagnoses. Endometriosis, I would expect to be more associated with painful periods rather than just heavy periods. Um, and I'll do another video again about dysmenorrhea or painful periods and the causes, and I'll talk a bit more about endometriosis there. The last thing I have to say is in adolescence, never forget possibility of pregnancy. So pregnancy can cause irregular bleeding, pregnancy can cause heavy bleeding, and we always take a sensitive history. Usually, if we're seeing an adolescence, we have a few minutes with the adolescents on their own just to have these sensitive discussions. But it's always worth bearing in mind, worth remembering that if that is a possibility, then it needs to be looked into. So I hope you enjoyed the video. Please subscribe to the channel because that would be really helpful. And if you've got any comments, please put it in the comments below. I'd love to hear your feedback. I want to make these videos as possible for you, as useful as possible. So your feedback would be amazing. Just a shout out to let you know, to pinpoint, I've got a new Facebook group called Gynecology Girl Talk. So please become a member. My plan is that it'll be a safe space where carers, parents can share their experiences about gynecological conditions in babies, in children, in adolescents, and to form a supportive community because I know that these things can be really trying and really stressful and can really impact not only the child's life, but also the family's life, the parent's life. So we're here to help you. Thank you for tuning in, and I'll see you soon.